Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking a little bit about the anatomy of the Eustachian tube. And along with anatomy, we'll also discuss a little bit of the physiology, what are the functions of Eustachian tube, a little bit of applied physiology, and also the embryology behind Eustachian tube. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So, first, we'll be talking about the anatomy before moving on to the physiology and embryology of Eustachian tube. So, in anatomy, we'll talk about a little bit of what it is made of, what are the different names given to it, what are the two openings of the Eustachian tube, the two parts of Eustachian tube, and the relations of these two parts. And then we'll talk about the blood supply, the nerve supply, lymphatic drainage of the Eustachian tube. So, what is Eustachian tube? We know that we have this mucus lined osteocartilaginous channel or a tube like structure which connects our lateral wall of the nasopharynx with the anterior wall of the tympanic cavity. Eustachian tube is that tube. So, this is basically a bony cartilaginous tube which is lined by mucus and connecting the lateral wall of nasopharynx with the anterior wall of the tympanic cavity. This eustachian tube, as you can see in the image over here, this here is our tympanic cavity, right? So our eustachian tube is beginning over here at the anterior wall of the tympanic cavity and it projects forwards and here it connects with the nasopharynx, the lateral wall of the nasopharynx. Now this tube has also been called as pharyngotympanic tube as because why is it known as pharyngotympanic tube? Because it is connecting a part of the pharynx with the tympanic cavity, and it has also been known as the auditory tube. This tube was actually named after Bartholomæus Eustachius, as you can see from the name. Now, a common question asked is what is the length of the tube and what are the parts of the tube? Now, the length of the tube is 36 millimeter long, but this number applies in case of adults only. In infants, you'll actually see the eustachian tube anatomy is quite different in infants when you compare it to adults. In my next class, I'll talk about the various differences that you have between the infant eustachian tube and the adult eustachian tube and how it impacts them in their regular life. So now let's talk about what is the direction of the tube. Now, if we look at the image on the right side, we can see that the direction here, the tube is starting here at the anterior wall of the tympanic cavity. And at this level, it is moving downwards, forwards, and medially towards the nasopharynx. And what it does is it forms an angle of 45 degree with the horizontal. So this angle itself also will differ in case of an infant. In adults, this angle with the horizontal is about 45 degrees. Next is what are the two openings of the eustachian tube? Now, as I mentioned, because it's connecting the nasopharynx with the tympanic cavity, so we have our tympanic opening and then we have our pharyngeal opening. So this here is our tympanic opening, right? So the tympanic opening is actually bony in nature and it measures about 5 into 2 millimeter. And as I mentioned already, it is situated in the anterior wall of the middle ear, a little above the level of the floor. If you try to remember the anatomy of the middle ear and the different boundaries of the wall and what are the relations of each wall, you'll remember that eustachian tube opening, the bony opening, is a part of this. Then is the pharyngeal opening. So here is our pharyngeal opening as you can see, and this is what our pharyngeal opening will look like in an endoscopic structure. So this here is our eustachian tube opening. If you look at this endoscopic picture, you can see how this looks like a slit as if, right? So this is a slit-like structure and the pharyngeal opening is actually the widest part of the tube. Can you tell me what is the narrowest part of the tube? The narrowest part of the tube we'll discuss in a little bit is actually a portion which is known as the isthmus. And isthmus is the portion which is the part between the bony and the cartilaginous part. So isthmus is actually the narrowest portion of the tube, whereas the widest part of the tube is the pharyngeal opening. And this opening, if we had to locate this opening, how would we locate it? It's situated in the lateral wall of the nasopharynx, about 1.5 centimeter behind the posterior end of the inferior turbinate. That is the landmark that you need to be remembering over here. And as you can see in this image, we can see something called torus tubarius here. The cartilage at the end of the pharyngeal opening of the eustachian tube, it ends up raising an elevation known as torus tubarius, which is again situated in the lateral wall of the nasopharynx. So these are our two openings. The tympanic opening is bony and the pharyngeal opening is cartilaginous, and both have their different attributes over here. Next, we are going to talk about the different parts of eustachian tube. So coming to parts, eustachian tube has two parts as I have mentioned before already. We have the bony part and then we have the fibrocartilaginous part. So the bony part is forming about 1/3 of the total length of the tube, which is about 12 millimeters since our total length was 36 millimeter. And the fibrocartilaginous part forms 2/3 of the length of the tube, which is 24 millimeter. And the area where these two parts are meeting is actually the narrowest part of the tube, and that is what is known as the isthmus of the tube. We saw in the image over here. Now let's talk about the different relations of each of these parts. First, coming to the bony part. Now, bony part is the posterolateral 1/3 of the eustachian tube. It is beginning in the anterior wall of the tympanic cavity. And as it proceeds, it gets narrower and it ends at the junction of the squamous and petrous part of the temporal bone in a jagged margin where the cartilaginous part of the tube is attached. And if you look at the cross section of this bony part over here, the lumen will be transversely oval. Next, let's try to understand what are the relations of this bony part of the tube. So if we look at the image over here, this is our auditory tube starting over here, right? The bony part. So if we look at the image over here, we'll see above lies the tensor tympani muscle. You can see the tensor tympani muscle passing in a bony canal. That is the relationship superiorly. Below lies tympanic plexus of the temporal bone over here. So this is our relation inferiorly. Then medially, we will have the carotid canal, which contains the internal carotid artery and a plexus of nerves and veins, which I'm not able to show you in this image, but if you imagine the 3D structure, you will be able to imagine that. And laterally will be the downturned edge of the tegment tympani. So these are the four relations of the bony part of the eustachian tube. Next, let's talk about the fibrocartilaginous part of the tube. Now, the fibrocartilaginous part is the anteromedial 2/3 of the eustachian tube. And if somebody asked you what kind of cartilage is this made of, this is actually made of a single piece of elastic cartilage. And this cartilage, what it does is it folds upon itself, and as a result, it will form the medial lamina, it will form the roof as well as part of the lateral lamina. But you can see that it's only forming a part of the lateral lamina. The rest of the lateral lamina is being formed by the fibrous membrane. So this is the structure of the fibrocartilaginous part. We have a single piece of elastic cartilage forming about the medial lamina, the roof, and a part of the lateral lamina. And only the rest of the lateral lamina is being made by the fibrous membrane, right? So that's about our fibrocartilaginous part. Next, what is elastin hinge? Now, elastin hinge is actually this region which is very rich in elastin fibers, and this is situated in the roof at the junction of the medial and the lateral lamina. Now, what is the purpose of having this elastin hinge? If you look at the image here, this is where the elastin hinge lies at the junction of the medial and the lateral lamina. So the purpose of the elastin hinge is that when it recoils, it tries to keep the tube closed when dilator of the eustachian tube. Now, can you tell me which muscle is called as the dilator of eustachian tube? It's the tensor veli palatini muscle. When tensor veli palatini muscle is not in active contraction. It is not acting. This elastin hinge is what is keeping the tube closed by its recoil action. So that is the purpose of having this elastin hinge in this over here. Next structure in the fibrocartilaginous part is the Ostman's pad of fat. Now, what is the Ostman's pad of fat? If you look at the image here, this is where the Ostman's pad of fat lies. Again, the purpose of the Ostman's pad of fat is also that it keeps the tube closed, and it is also related laterally to the membranous part. You can see we spoke about this is the fibrous membrane part which is forming the rest of the lateral lamina. That's the relation of the Ostman's pad of fat. So this is basically a mass of fatty tissue which is keeping the tube closed. And by keeping the tube closed, it is protecting us from the reflux of the nasopharyngeal secretions into the tube. So this is the Ostman's pad of fat, which is another structure in the fibrocartilaginous part that we need to know. So both these structures, they are keeping the tube closed when the muscle in action is not contracted and keeping the tube when it is not contracting and opening up the tube. So this fibrocartilaginous part, actually, it passes downwards, forwards, and medially along the sulcus tubae. Now, what is sulcus tubae? It is actually a groove on the undersurface of the base of the skull, and the two structures which are articulating to form the sulcus tubae is the greater wing of sphenoid and petrous part of the temporal bone. Now, posterolaterally, the cartilaginous part, as you know, is attached to the anterior end of the bony part, because we mentioned how this is the tympanic cavity, this is the bony part, then we have the cartilaginous part, and this is the nasopharynx. So we can see that posterolaterally it is attached to the anterior end of the bony part where it is forming the isthmus, and at this isthmus the tube is actually not straight. It's not a smooth transition from the bony to the cartilaginous part. At the level of the isthmus, the tube gets slightly bent because both the bony parts and the cartilaginous parts, they are not lying in the same plane. Anteromedially, what happens as the fibrocartilaginous part proceeds, it passes through the sinus of Morgagni. If you look at the image here, this is the sinus of Morgagni, and you can see that the tube is passing through the sinus of Morgagni right above the superior constrictor muscle. If you remember the anatomy of pharynx, you'll be able to remember this. I have separate videos on that. You can check it out there. So what it does is the eustachian tube passes through the sinus of Morgagni, then it pierces the buccopharyngeal and the pharyngobasilar fascia, and then ends up opening in the lateral wall of nasopharynx. So that is the journey or the direction that the eustachian tube is passing through. And we have learned about how the cartilaginous part has these different portions and what is the function of each one of them. Lastly, let's try to understand what are the relations of this cartilaginous part. So if we look at the anterolateral section, the relations are spinosphenoid and the tensor veli palatini muscle. This here you can see the tensor veli palatini muscle. This tensor veli palatini muscle separates the tube from these following structures: mandibular nerve and its branches, otic ganglion, cauda tympani nerve, and the middle meningeal artery. This is the anterolateral relations. If you look at the posteromedial relations, we have the apex of the petrous temporal bone, levator veli palatini, pharyngeal recess, or the fossa of Rosenmuller. And above, as I mentioned already, lies the structure called sulcus tubae, and below lies the superior constrictor muscle. So these are the relations of the different parts of the eustachian tube. Now let's try to understand what are the muscles in relation to the eustachian tube. So there are three muscles over here that we will be talking about. The first one, the most important one, is the tensor veli palatini muscle. Sorry, not this one. So the tensor veli palatini muscle is actually the only muscle which is making some move, which is contracting to cause a change in the structure of the lumen of the eustachian tube. So it is the only muscle that directly affects the dilatation of the eustachian tube. So the medial fibers of this tensor palatini muscle, they are attached to the lateral lamina of the tube. If you remember the structure here, this is a lateral lamina, and this is where the tensor palatini muscle is attached. You can see in the image over here, this is the tensor palatini muscle. You can see the first image over here is when the tube is in closed resting position, and you can see the slit-like opening. But when this tensor palatini muscle contracts, it pulls the lateral lamina like this, and it opens up the eustachian tube as you can see here. So that is the role of the tensor palatini muscle. It contracts to open the tube. The second muscle that we have is the levator veli palatini. You can see in the image here, this is the levator veli palatini muscle. This muscle runs inferior and parallel to the cartilaginous part of the tube, and it forms a huge bulk under the medial lamina. So the tensor veli palatini was more related to the lateral lamina, whereas the levator veli palatini is related to the medial lamina. And this muscle, when it contracts, what it does is it pushes the tube upward and medially and assists in opening of the tube. And third muscle that we have is the salpingopharyngeus muscle. As you can see over here, this is our salpingopharyngeus muscle. So these are the three muscles that we have in relation to the eustachian tube. Next, let's talk about what is the lining, mucosal lining of the eustachian tube. Now, we know we'll discuss in a little bit about the functions. One of the things is that one of the functions of eustachian tube is that it helps in drainage of secretions from the medulla into the pharynx. So that kind of drainage would require some kind of cilia, right, in the mucosa. So the mucosa, if you look at it, it contains pseudostratified ciliated columnar epithelium, and this is interspersed with mucus secreting goblet cells. And in the submucosa, particularly in the cartilaginous part, it is very rich in seromucinous glands. These cilia that we just mentioned, they beat in the direction of the nasopharynx, therefore helping in the drainage of secretions and fluids from the middle ear into the nasopharynx. And another peculiar nature that you will come to know is that the density of these ciliated cells and goblet cells that we are talking about, they actually increase from the tympanic end to the pharyngeal opening and from the superior to the inferior aspect of the tube, thus helping in the direction of the drainage of these secretions. Next is, let's talk about blood supply of eustachian tube. So blood supply we'll always divide into arterial supply and venous drainage. So arterial supply is by middle meningeal artery, artery of the pterygoid canal, and ascending pharyngeal branch of external carotid artery. Venous drainage is all the veins drain into the pterygoid and the pharyngeal venous plexuses, and lymphatics drain into the retropharyngeal and upper deep cervical nodes. Lastly, for the anatomy section, let's talk about the nerve supply. When you talk about nerve supply of any structure, we'll divide it into a mucosal or the sensory supply and the motor supply. So let's look at the sensory supply first. So the pharyngeal portion, which is the cartilaginous part, this is supplied by the pharyngeal branch of the glossopharyngeal nerve via the pharyngeal plexus, whereas the tympanic portion, which is the bony part, this is given by the tympanic plexus. And if you remember your anatomy well, you'll remember that the tympanic plexus is formed by Jacobson's nerve, which is also known as the tympanic branch of the glossopharyngeal nerve. So glossopharyngeal nerve itself is supplying the whole thing, but through different plexuses. The cartilaginous part gets the pharyngeal plexus, the bony part gets the tympanic plexus. And coming to the motor supply, we have tensor veli palatini muscle, which is supplied by the mandibular branch of the trigeminal nerve, and the levator veli palatini and salpingopharyngeus is supplied by the pharyngeal plexus, which is formed by the cranial part of the 11th cranial nerve through the vagus. So this is about the anatomy of eustachian tube. Now we'll be talking about the physiology of eustachian tube. The next portion that we'll talk about is the physiology of eustachian tube, meaning what are the functions of eustachian tube. So we'll see that actually the eustachian tube has three important functions. The first one is that it ventilates and regulates the middle ear pressure. Second is it has some protective functions. And third is that it helps in drainage of middle ear secretions. So first one is ventilation and regulation of middle ear pressure. What the eustachian tube does is, so this is our eustachian tube and this is our middle ear, right? And then we have the tympanic membrane which forms the medial wall of the middle ear. So if this is the tympanic membrane, what eustachian tube does is, if this is the ESE and this is the middle ear, and this is the tympanic membrane. The eustachian tube tries to maintain an equilibrium of ear pressure on either side of the tympanic membrane. So it keeps opening from time to time to equalize this pressure in the middle ear at the ambient pressure. So at rest, when you look at the eustachian tube, you will find that the tube is closed, and this tube keeps reflexly opening when you swallow, when you yawn, or when you end up sneezing. So the purpose is basically that there is never a lot of air pressure developing on the tympanic membrane. It will equalize the air pressure on the external environment and the internal environment in the middle ear. Now, this function of the eustachian tube actually gets affected with posture. So, tubal opening becomes less efficient when you are lying down and during the time of sleep because of venous engorgement. And tubal function is particularly poor in case of infants and young children. So you'll see that young children will actually come to you with more ear problems in that particular 7 to 10 years of about till about 7 to 8 years of age group. But after they turn 7 to about 10 years of old, all those problems start normalizing because the structure of the eustachian tube itself also changes to an adult structure. So this was our first function, which is basically ventilating the middle ear and maintaining an equilibrium of air pressure on each side of the tympanic membrane. Second is our protective function. So we have two protective functions over here. The first protective function is when there is a lot of high sound pressure coming from the nasopharynx, it can be transmitted to the middle ear if the tube were open. Thus, if that was happening, imagine if that was happening, any kind of high sound pressure coming from the nasopharynx, you're feeling it in the middle ear, then it will interfere with your normal hearing. So, what happens is normally the eustachian tube remains closed and it tries to protect the middle ear against all of these high sounds. So, it has a protective function from the high sound pressures developed. Second is it also protects the middle ear. If you look at the image here, this is our middle ear here. It will protect the middle ear from any reflux of nasopharyngeal secretions, which can happen if the eustachian tube was not patent properly. This would happen that there would be reflux of the nasopharyngeal secretions right into the middle ear. And this reflex is more readily occurring. We have a particular condition where what we known as the patulous eustachian tube. We'll talk about that in a separate class. So this reflux will happen very readily if your eustachian tube was patulous, or if the eustachian tube is shorter in length, which is seen in case of infants. So you'll see that infants actually have more of a reflux of nasopharyngeal secretions in the eustachian tube. Third, if the tympanic membrane is perforated, you'll see in these cases the persistence of middle ear infections would be the one of the reasons would be the eustachian tube dysfunction, because it is not able to control the reflux of the nasopharyngeal secretions. So these tympanic membrane perforation cases, they'll have persistence of middle ear infections because the physiology of eustachian tube has also gone wrong. So these are the two things that the eustachian tube has protective functions about. And the high pressures in the nasopharynx can also force the nasopharyngeal secretions into the middle ear, like when you are forcefully blowing your nose, or in case of bilateral nasal obstruction that you see in case of adenoids. Next, coming to our third function, which is drainage. What it does is, if this is the middle ear, it drains all the secretions of the middle ear. Uh, mm, we spoke about the lining of the tube, which is the pseudostratified ciliated columnar epithelium. And we also spoke about how the cilia beat in the direction of the nasopharynx. So this is what is happening. It is helping to clear all the secretions and debris from the middle ear right out to the nasopharynx. This is the clearance function or the drainage function of the eustachian tube. So these are our three important functions of eustachian tube. Now let's talk about a little bit of applied physiology. And the commonest thing that we can associate with this is when we get up on an aeroplane. So when you're ascending in the aeroplane, many a times we have felt this discomfort in our ears, right? Like, let's try to understand what is the physiology behind that. So when you're ascending in the aeroplane, the atmospheric air, which is outside the tympanic membrane, it starts to become less dense. As a result of which, the air within the tympanic cavity starts expanding and it is pushing the TM outwards, or the tympanic membrane outwards. Finally, the higher air pressure in the middle ear may force the auditory tube to open up with a click like sound. So you'll see that you often try to do Valsalva to try to open up the Eustachian tube when you're trying to fly, because sometimes you may have this discomfort that you're feeling in the ear, which is happening because of sudden change in atmospheric air pressure, and the Eustachian tube is working hard to equalize the air pressure on both sides of the tympanic membrane. So this is what is happening when you're ascending in an aeroplane. When you're descending very rapidly in an aeroplane, again, the pressure change gets reversed from what we just learned. So now in this case, what happens is the tympanic membrane, it starts getting retracted inwards towards the middle ear. As a result of this, we have severe earache and temporary impairment of hearing. Not all of us, obviously, some of us. To avoid this discomfort, we often try to swallow air frequently. A lot of people even use chewing gums. That also helps you in trying to open the Eustachian tube. So, unless this pressure difference ends up reaching a range of about 100 to 500 millimeter of mercury, usually nothing will happen. But if it crosses this level, in that case, your tympanic membrane may get ruptured. So this is the physiology of how the Eustachian tube tries to maintain its first function that we discussed, which is regulation of the middle ear pressure. But when you're ascending or rapidly descending in an airplane, the pressure changes are happening too fast. So this is about the physiology. Lastly, a little bit about the embryology of the Eustachian tube. It's actually quite simple. Each tube gets developed from the medial tubular part of the tubotympanic recess, which itself is formed by the fusion of dorsal parts of first and second pharyngeal pouches. The lateral part of the recess, it dilates and it forms the mucous lining of the tympanic cavity, tympanic membrane, mastoid antrum, and mastoid air cells. So our tube is developing from the medial tubular part of the tubotympanic recess, whereas the lateral portion is forming the rest of the middle ear cavity and mastoid. So that completes our class today on anatomy, physiology, and embryology of Eustachian tube. If you have any doubts regarding this, please note them down in our comment section and I'll get back to you. Thank you.